All right, guys, so I'm going to be treating this patient's periorbital region with Morpheus8. Specifically, I'm treating her under eyes, her lids. So we've done one session so far, and she has actually pretty significant improvement of her under eyelid. But to get a good anesthesia and to make the patient very comfortable, I'm going to be doing an infraorbital nerve block and a supraorbital nerve block to really numb the upper and lower lid. So the way I do that is, I tell the patient to open her eyes, abre los ojos.
And then I have to locate the infraorbital foramen. So the infraorbital foramen can be located just below the infraorbital rim, and it's usually mid-pupillary line and about 1 centimeter below the infraorbital rim. You really have to palpate and feel it. You're going to feel like a little groove. You feel the little foramen there. And once you landmark it, you really want to mark that off just so you don't lose your spot. And then I'm going to go straight to the other side and do the same thing. And now for the supraorbital nerve block to numb the upper lids. You're going to draw again like an imaginary line, mid-pupillary line, and it's just above the supraorbital rim, about 1 centimeter as well. So it feels like a little foramen, a little notch, so you're going to go ahead and mark that off. Here's a little diagram for your reference just to locate the supraorbital foramen, infraorbital foramen, and then mental foramen. Now, to do the actual nerve block, I use lidocaine 1% with epinephrine, and I inject about 1 cc per area, and I inject at a 45-degree angle, and I let it sit there for about 2 to 5 minutes to get the area really numb.
So, as you can see, the patient is very comfortable. ¿Cómo se siente?
Bien.
Bien. Okay. And usually if you've had Morpheus, you know that this procedure is extremely painful, but when done with proper numbing, patients are very, very comfortable. So now let's do her upper lid, and I'm going to go down to a 2 millimeter depth, and we're going to put the skin taut. ¿Le duele?
No.
No pain?
These nerves provide sensation to the upper eyelid, to the forehead, extends to the scalp. The infraorbital nerve provides sensation to the lower lids, cheeks, nasolabial fold, upper lip, and corner of the nose. If you have the means to inject in your practice, do so for the best comfort of your patient.